Well, there were some things that happened before I brought this into my practice, things that happened in my family of origin that kind of woke me up a little bit. But then I would say the key situation was a woman that I was treating for panic disorder, a 50-year-old woman. She had one child, and she had a marriage that wasn't so good, and she was having this panic. And I did all the standard things. I did cognitive behavioral therapy, and that didn't really work. And then I did some imipramine, which was the medication at the time, and that kind of didn't work. And then, so I said, well, let me try some Nardil, the MAO inhibitor, and that should really work, but that didn't work. And then I said, well, okay, maybe some Xanax. But that didn't work. And then this is a year into the treatment. She paged me this is the years when we had beepers. She paged me at a wedding and said, she's having a panic attack. And so Monday morning, I came into the office early and looked at her chart, and I had a couple of lab tests. One was a blood count, and the size of her red blood cells was a little bit larger than normal. So I had seen that, but I had ignored it because that's the way I was trained. It's just a little bit out of the range. So I did a little research, and lo and behold, she had a B12 deficiency. I gave her an injection of B12, and with the first injection, her panic was gone. And so I said, okay, listen, good luck. Keep taking your B12, and hopefully I'll never need to see you again. She came back 2 years later, panic attacks. I said, are you taking the B12? She said, no. I said, good luck. Now keep taking your B12. And then I realized, I said, well, there must be some other stuff going on, because the head is connected to the body by the neck. And most of us miss that in a lecture or something in psychiatry anyway. So I started exploring, and one thing led to another, and developed this system of kind of looking under the hood to get to the root causes of things wherever possible.